All right. Hi, everybody. I am just getting us set up here. We are going to have a great conversation today with Ashley. June is ICP Awareness Month, and we are going to be learning about Ashley's story and just hearing about some risk factors and symptoms for ICP. So let me just make sure. I think I'm having some trouble connecting to Instagram. So just give me a moment, everybody. All right. All right. Well, I think I messed up the Instagram stream. Because nothing is coming up on this end. Well, we can just continue our conversation here.
That sounds good.
All right, perfect. So, all right. Well, Ashley, thank you so much for being here. June is ICP Awareness Month. I feel like I always struggle naming the conditions.
Yes. So ICP, yes. ICP is Intrahepatic Cholestasis of Pregnancy. Hepatic relates to the liver, and it is a gestational liver condition. So,
okay.
that is
And so, yeah. And so thank you for being on with us today. And for those of you who might just be tuning in to the first time to one of our lives, Push Pregnancy is a leading stillbirth prevention organization. And it's founded by mothers who have experienced stillbirth for, a variety of reasons. And really, we are here to provide all the what we wish we knew elements of pregnancy. And I know that I did not learn about ICP. I did not experience ICP, but I did not learn about this condition until, unfortunately, I joined this community as a lost parent. I feel like it's not a condition that we hear about often. And so, Ashley, I would love for you to just, share your story about it and just kind of explain, because I feel like this could be the first time a lot of folks are hearing about ICP.
Yeah. So my story is not one of loss. I will say our founder, Donna Benavides, and many of our ambassadors and board members have experienced loss. And stillbirth is the most significant, most severe side effect of ICP. Whether or not you are induced or not with this condition, just like off the top, your baby will be born early. So the longer the pregnancy goes, the higher the risk of stillbirth.
Right.
So that's why this is like knowing the symptoms and knowing, having a health professional that you're working with that has experience with this condition is so important to deliver early. So I've had 2 itchy babies. My first one, he's 6 now, came fast and furious, very early. So I'd actually been traveling for work. I was in a hotel and started itching. My hands and feet were kind of itchy. I immediately thought bed bugs, right? I'm in a hotel. Like,
I would think the same thing.
Disgusting. Oh my gosh.
You never know.
It's like so gross. I'm pulling the sheets. I'm not seeing anything. So now I'm going online to look. I know that itching is normal in pregnancy, but I also know that it's normal, mostly around your stomach. Like, yes, you can have dry skin, but a lot of it comes from the stretching, right? So I'm like, hands and feet. Like, this is, to me, it was an indicator that something was kind of weird. Yep. So I looked it up. I did discover ICP, had never heard of it, and thought to myself, okay, if I'm still itchy when I get home, it was, maybe a day or so before I was supposed to return home, I will contact my clinician. Well, I got back and it subsided. So I made the mistake, and I am saying this, please don't make the same mistake. So I made the mistake of just ignoring, right, what had happened.
Which is so normal, by the way. I feel like we do that a lot when
like, like, I'm willing it to not be ICP.
Right.
So fast forward another couple of weeks. So that was probably around, I want to say like 20, 29 weeks. So fast forward another couple of weeks and the itching comes back. Now The health system I work with, the clinicians actually do respond and communicate via the patient portal, like the app that so many have. So I sent a message trying to be calm. Here's what I'm experiencing. I have, my hands are sort of itchy, my feet are sort of itchy. Knowing in my head what it probably is, but still trying to maybe I can will it to not be ICP.
Right.
Instead of responding in the portal, my doctor's office called immediately. I mean,
Just
it was probably within minutes of me sending the message.
gosh.
They called and told me to get in and we're going to, run some tests. Now, the
I
unfortunate
wish
thing
all
is
doctor offices were like yours because it is
they're
amazing.
not.
You're so responsive.
Yes,
Honestly, we hear a lot of times with, all different types of stories, how people were, sharing information and were just kind of dismissed. So kudos to
100%.
your medical team because, we hear the opposite a lot more than
100%.
the goodness
So
that you
often. Yeah, so often clinicians don't have the experience with ICP and they
share.
will tell patients itching's normal. Don't worry about it. Use some lotion. It's heartbreaking because again, the underdiagnosis and the dismissiveness of this condition is what leads to stillbirth.
Right.
What leads to complications for mom. And it's just so heartbreaking. And so I do feel very fortunate that I had a team that knew the condition and treated it with the severity and the urgency that it really needed.
Right.
And so I did. I got in and I got tested. But the caveat and the sort of unfortunate thing is that in our country, the labs that do the specific testing are only in a couple places. So it actually takes a couple days to get results.
Oh,
They're not immediate. There are some labs that can be done to test different aspects of liver or bile acids, but
okay.
the true bile acid test is not an immediate one, unfortunately. So I was waiting for my results over these, couple of days when I went into labor the first time. Um, Again, I was trying to downplay, and I'm like, it's probably
Yeah.
Braxton Hicks. I was out to lunch with my mom, and
No.
she kind of was noticing that I kept kind of, grabbing my stomach
Yeah.
every so often. And she encouraged me to actually count how
Yeah.
frequent.
Yeah.
And it turns out it was
Yeah.
actually true
Okay.
contractions. And I was in labor at 33 weeks. Um,
Wow.
so I went
That's
in. It was terrifying. And again, very fortunate to have a team that acts with urgency, knew what they were doing. They were able to stop the labor. They also gave me, or my baby, I should say, a steroid and surfactant,
Yeah.
which I also do some work with March of Dimes, and they were responsible for the creation of surfactant with the research that they do. So I was like, thank you to you also.
Yeah.
And um, went home, was put on bed rest. Part of my story, and this is like a quick little synopsis, is that
Good.
I got married in the time frame that I was on bed rest before I actually gave.
Oh
So I
gosh.
had to sit with my feet up,
Wow.
basically at my wedding.
Oh my goodness.
And yeah, it was the we're gonna do a redo at some point, but um,
But
it was a chaotic birth
at
story.
that point, were you formally diagnosed yet or no? Did you
While I was in the hospital in labor is
Okay.
when the doctor came in and said,
Just came back.
"Okay, you
Okay.
do have ICP." Um, and
Wow.
so I was put on urciderol. I'm sure I'm butchering the name of that medication. Urso is what it's colloquial,
Okay.
called, the nickname Urso.
Yeah.
Um, and that is supposed to help with reducing the bile acids, which should reduce itching. They're
Okay.
not always correlated. So sometimes you could have really high bile acids and not be super itchy, which is something to consider and why it's important to get tested.
Yeah.
My bile acids were 107. The minimum diagnosis is 10. So anything 9 or under, you're in the clear. 10 or above, you have ICP, and mine
And
were 107.
again?
Yeah. So ACOG, which is another association, has since that happened put out updated delivery timing. So previously, I think it was 37 or 38 weeks was the recommendation. So if you're over 100 now, the recommendation is 36 weeks or earlier to deliver because of the
Do you know
risk.
what the average is? 'Cause
Um,
women do
right
so
now, I'm not sure, but
intense.
that's a great lead in because we do have a patient registry. So icpcare.org is the
Yeah.
website. We have a link to our patient registry, and the more information that we are able to get for research is so important in figuring out these averages and information on, how to prevent or to at least better support moms.
Do you think that ICP is being diagnosed enough, or do you think there could be
I
people
I
that
personally don't, based on just conversations with people I know, based on conversations that I see happening in our support page on Facebook for ICP Care.
yeah,
We are so frequently having moms come say, "I'm here because I was looking at my symptoms," and I will get into the whole list of
yeah,
those symptoms.
I
And my doctor's, dismissive. My doctor's saying that, if I'm not itchy and even if my bile acids are here, that it's not ICP, or if I'm like at 9 point something, it's not ICP, but I'm itching so, significantly, or,
mean,
they won't test until later in pregnancy because it's really a late term condition.
okay,
A lot of people do get it earlier. So I think right now the data says that it's 1 to 2 in 1,000 that are diagnosed with ICP. And I would venture to guess that the numbers are actually much higher than that.
yeah,
And I think that the underdiagnosis is really what leads to a lot of the most severe conditions.
and it sounds like I think you just talked about it earlier. It seems like, a lot of medical providers might not be so aware of it themselves, which is why I'm so happy that, ICP Care is here to help change that. I don't think we finished your whole
Oh,
story.
no. Yeah.
You were
So got
got
married.
married.
Got
Congratulations.
married. Yeah.
Love that
Um,
for you in the
yes.
hospital. Oh my
Yeah.
goodness.
So got married. And then it was at 35 weeks. I felt very sharp pain. I woke up. I must have a super high tolerance to pain because I think I like actually slept through the majority of labor. So I woke up and I'm like, oh, I must have, I'm constipated. Like,
And is
sorry,
this in the
TMI.
hospital?
So I'm
This
at
is
home.
you're at
I'm at
home.
home at this point. So
Okay,
my bed rest was at home.
got it.
And I woke up in the morning. I think it was like 35 weeks in 2 days.
Yeah,
And I'm like, I just have this very intense, sharp pain,
yeah,
and was convinced like like something's wrong on my insides. I'm still
right.
not convinced that it was labor, because I didn't have the contractions. I actually think I slept through the contractions. And
Woo.
so I called and, talked to my doctor, and I'm like, what do you think? They're like, you should probably come in. So we get to the hospital. We're like at 8 o'clock in the morning. So sorry for the background noise.
It's fine.
Um, we get to the hospital, 8 o'clock in the morning. They're like, let's get you examined. And they're like, oh, you're complete. Okay, this is my first pregnancy. I don't know what that means.
Oh, yeah, of
Yeah.
course.
And they're like, "Oh, you're fully dilated. You are about to deliver this baby." Um, and so I had been on the fence about, do I want an epidural or not? At this point, it was not an option. So delivered fast and furious within like 15 minutes of arriving at the hospital. He was born. He Now here's some of the other side effects and complications, right? So distress, babies in distress, right? Heart rate can be affected by increased bile acids. Meconium staining or aspiration
Yeah,
could be an effect. As we know, meconium aspiration, again, can lead to death
yeah,
for baby. Um, my son did have meconium staining. He did not aspirate. So we were extraordinarily lucky
yeah.
that didn't happen. He was in distress. He had like his shoulder was stuck. They ended up having to use vacuum and an episiotomy, again with no drugs.
That
So
is
this is just, it was the like most extreme case.
Yeah.
They get him out, and I think they gave him like maybe 2 puffs of oxygen. But again, going back to the fact that he had the steroid and he had the surfactant and had a team that treated
Right.
me and my baby with the thoughtfulness and the urgency that they needed to, he ended up not needing NICU time, which is like
Well,
crazy. He was a full month early.
I mean, that just speaks volumes to acting on a situation when risk factors and symptoms are present. I mean, that is a story that I really hope this video can find its way to providers to see when you step in. That is
Yeah.
amazing.
Yes.
Ugh,
So he was, getting cleaned up, and they were, checking his vitals and everything, and he did actually pretty great on the APGAR. Meanwhile, I'm still, getting cleaned up and stitched up and all that, and I could feel something, and it was like, um, just like wetness. Sorry, again, I'm like, I don't know, want to be too
that's
graphic.
okay. I mean,
Um,
you got birth,
and
so
I,
pretty normal.
yeah, at that point, like, somebody had stepped away and I'm like, "Hey, can you check?" And they're like, "Oh, I was bleeding." And so they started to weigh the pads. This is how they, do it when you're hemorrhaging. They weigh the pads that are under you.
Yes.
And it
Yes.
was significant. And they discovered that I had retained placenta. So the condition of the placenta can actually be affected by ICP. It doesn't always mean retained placenta. It doesn't always turn out to be something negative. But again, I had very high bile acids, and my condition was on the severe side of ICP. So they ended up having to take me into surgery. I hemorrhaged, I'm trying to remember how many cc's. It was like almost all my blood. Like if it's like
Actually, so scary.
400, if we have 500 cc's, this is not accurate numbers. Please don't
That's
then I
okay.
hemorrhaged 400.
You're good.
It was close. I had to have like almost a full transfusion. And they had to do a DNC. My son was, in the meantime, he, instead of NICU, he was in the nursery at our hospital for
Okay.
8 hours was the observation time. So I had initially been kind of upset about the fact that he was going to be in observation, not because I didn't want him to have it, but because he wasn't going to be with me.
Course,
Meanwhile, like
course.
minutes later, well, forget that concern. Now I'm being rolled into surgery for the DNC to remove the retained placenta and to get my transfusion and all of that. Again, this is one of the more significant, severe cases. This doesn't happen to everybody, but it can happen.
Yeah.
So I think, I
Well,
went
and I
down the
can
checklist.
imagine what may happen for someone that is not properly diagnosed.
Hmm.
Yeah, I mean, and we need to share these things, and it's not to scare anybody or anything like that. I mean, we just have to be aware of what can happen to us. I feel like the more we're
Absolutely.
informed, the better that we can advocate for ourselves. So,
A
no, I
hundred percent. A
so
hundred
appreciate
percent.
you hearing this.
And my day job is patient education and engagement.
Oh my
So
gosh, I
it's
didn't know that. Okay, so
Yeah, so it's to me, it's, I'm so glad that part of the work that I can do even in my day job is to create, or yeah, I'm not the one that creates it, but my team creates it, education and, programs that can help patients be better advocates for themselves. And I kind of think it's unfortunate, but I think it's so important that we are able to speak up for ourselves.
yeah,
And I think that, ICP Care does such a good job of creating material and awareness for clinicians that don't have the experience, families, mothers that are expecting, that don't have the knowledge. I went back to my, what to expect when you're expecting book, and
yeah.
it's like in the back in, a glossary of,
Lots of things that should
it's
trigger
not.
family.
It's just, it was there, but it was just, it's tucked in the back, and I had never heard of it before I started itching myself. And one of the other symptoms I had was upper right quadrant pain, and it sort of mimics heartburn. So in my pregnancy, or especially later, I was taking heartburn medication, whatever I was allowed to
Such
during my
a
pregnancy.
common I feel like I still have my heartburn from being pregnant
Right.
3 years ago. So,
Right.
yeah, that's so common.
And it was like nothing was working because it wasn't actually heartburn, but that's what I thought it
Yeah,
was.
right.
Um, and would not have known, if if I hadn't found ICP online. So
So, will some people maybe have that symptom and not the itching?
itching is the most
Oh,
prominent
yeah,
symptom. It's
okay,
not always
but
super severe, but it is the primary most prominent symptom that somebody will have. The upper right quadrant pain, also dark urine, pale
okay,
stool, really anything. If anybody is familiar with liver conditions or liver disease, a
right.
lot of these symptoms are similar across the board, whether you're pregnant or not, when it comes to liver conditions. Um, and just not feeling good. And again, this is one of those things where it's um, you're pregnant, you don't feel great,
Yeah,
but feeling like sort of extra sick or extra down or being and it's hard to say, right, what's extra at that point, but I think it's so important to maybe over communicate with your clinician, with your doctor,
yeah,
how you're feeling, what's going on, anything that's out of the norm. I think should be communicated because all of these things add up and it could be cholestasis. So
yes. Wow, okay, so after everything, you have 2
I do.
children.
I do have two itchies.
So,
So
is it always guaranteed that you're gonna have ICP again?
it
Or
is, I think the data says 60 to 90%.
okay, okay,
So
so
it's
if you
pretty significant.
yeah,
Most people do end up having cholestasis again. Um, there are people who have followed really strict diets, and I don't know that there is research to say this is a given that you won't get it. But like a liver disease diet, like less fatty, there's a whole list on our site, icpcare.org, where you can look up all the nutritional recommendations. And people have said that it has helped. My bile acids in my second pregnancy were much lower. They were 21, 22 instead of
that's
107.
drastic improvement.
So I was able to actually schedule an induction. She did not
Yes,
come early on her own.
yeah,
So she was scheduled at 37 weeks. My doctor even said that it it could have probably gone to 38. I, knowing the risk of stillbirth,
yeah, yeah,
was not interested in testing fate, and so he agreed that it was fine. I said, let's do 37. I don't want to take the chance.
yeah,
And it
yeah,
really affects, like, once you have it, and parents who have had loss, I'm sure
yeah,
similar. In the second pregnancy, I never felt a point where I felt like I was in the clear until she was
yeah,
here and she was breathing and
of course,
healthy. Like,
of
there
course.
was no point where I was feeling in the clear at all.
Yeah, feeling safe. And well, and I think we talk about this a lot at Push. You know, we like to think that there's a safe point, right, in pregnancy, but there's unfortunately not. And I feel like my main saying in my post Aaliyah life has been you don't know what you don't know. And for so many of us moms, we just didn't know all of these things that we should have known, which is why we are here doing this and having these conversations. And I mean, as I said earlier, I did not know anything about ICP, but now I do. And I know if I have a friend that's, pregnant and texting that her, hands are itchy, I'm going to know exactly what to say.
Absolutely.
And it shouldn't take these drastic, for me, it shouldn't take the life of my daughter. For you, it shouldn't take a hemorrhage and all of that for us to, really start taking this stuff seriously and being comfortable talking about it without trying to scare anyone.
Yeah.
Um, so the major initiative for ICP Care is the registry and just kind of getting more research and stuff.
Yes. So the registry is
Yeah, share the
key.
website and stuff, like, where people can
Yes.
find you guys.
Yeah. So icpcare.org, it has a patient registry. As you mentioned, June is ICP Awareness Month. So we also have a virtual walk run that's going on.
Oh,
People
awesome.
can sign up, join a team, create a team if they
Oh,
want
great.
to. So this is like our big month. The 22nd is the start of that virtual event. So it's right around the corner.
Yeah.
But also there are pamphlets that you can download for patients, for clinicians, infographics that you can download. So if anybody wanted to, they could go to the website and print out the information, and give it to like a local health system doctor,
Right.
OB office, or if they have a friend who's pregnant and could use the information. It's
For
there,
sure.
it's accessible, it's digestible.
Yep.
So awareness is definitely a key
Yeah.
goal of ours, and also the research aspect as well.
Well, this is great. Do you think there's anything about the condition that we didn't touch on that you feel like last minute want to add in? I actually did have a question that I
Yeah.
forgot to ask. Now it's coming back to me. Is this genetic? So, like, do you think your
Yeah. So, what causes ICP is still sort of undetermined in the research that has been done, and it is limited research. Again, think about
yeah,
the data of like how many people actually are diagnosed with it.
right?
It's been shown that women with Swedish or I believe Latin American heritage are more likely. Genetics do play a factor.
Okay.
Um, I have, and I'm trying to remember now. I did some genetic testing after and discovered that I have like one variant in this
Okay.
liver part of my DNA. It's I feel so awful that I don't remember, but I can give you the information later
Oh,
and we can
that's
share it.
yeah.
But I found it interesting that I ended up with a liver condition and I had this, one variant in my DNA for liver. Um, so it is something. I think genetic testing can be done, asking family, even if
Yeah,
people weren't diagnosed, right?
for sure.
Because think
Yeah,
about like your grandma is not going to be, likely
right.
diagnosed with ICP. Your mom may have not been diagnosed with ICP, but did she have itchy hands? Were you born early? These are questions that you can ask your family for sure.
Okay. That's super helpful. I think
Hmm.
especially yeah, that was so helpful. I'm trying to think if I had any other questions. I think that was like my main one, but
Yeah.
thank you, Ashley,
Yes.
for being here. Did you have anything else that you wanted to add?
I was just gonna say it is so important with the symptoms and communicating with your team. So I know like count the kicks, right? Is something that's important, and paying attention to your body with ICP. And again, not to scare people, but it can go from you feel fine, you're feeling baby moving to not. It's a really sudden
Mhm.
um, shift that
Yep.
can happen when it comes to the condition of your baby and the condition of your body.
Yep.
So, my doctor even made the point. I was going in for the non-stress tests and checking movement every so often. Again, I'm so grateful that
Yeah.
they were on top of it. But he mentioned one day as I was leaving, and he goes, again, call immediately if you notice anything, because it does. It goes from okay to not okay in an
Okay.
instant.
Yeah.
And so definitely paying attention to the movement, counting kicks, but it's like if there's the slightest shift, the
Yep. And we
communication.
do that
Yes.
all the time. If you notice
Yes.
something different, do not wait.
Yeah.
Don't try to, yeah, see how you feel in an hour.
No.
No, this is part of
Yeah.
having an empowered pregnancy. It's part of knowing what is
Yes.
normal for your body, which we stress a lot.
Yes.
And most importantly, using your mom voice
Hmm.
and, and not being afraid to do that. So I'm so happy that you're saying that
Yeah.
because yeah, waiting an hour could change everything. And
It
it's
could.
doesn't matter who you're bothering. Go and
Yeah.
take care of yourself and
Communicate.
that is
Communicate.
your job. Yeah.
Yes. Yeah. So I
Yeah.
would say that's it.
Well, that is huge. Thank you so much, Ashley, for
Thank you
being
for
here
having me.
for ICP Care because I know I have learned a lot from the org, and I hope that this condition can be further researched because it doesn't matter that it's such a low percentage. Like we should be able to do do better. So thank you for all the work that you and the org are doing. And anyone who has questions, please feel free to reach out. We will respond as soon as we can if you want to learn more. And I know ICP Care also has, as Ashley mentioned, the events going on at the end of the month. So if you want to take part in that, definitely go to their website. And thank you all so much for hanging out with us today. Apologies for my little Instagram issue. I got to get better with our StreamYard. But Ashley, I'm just so happy that you were here. Thank you.
Thank you. I appreciate it. So good to talk to you, Liz.
Yes. And everyone, have a great rest of your day. And feel free to check out our website, pushpregnancy.org. We have so much information there. And always remember to use your mom voice and know you're normal, because you know you and your baby best. All right, everyone, have a great day. Bye.